Welcome to IRG's Health Talk. I'm Tom Hutler along with Shannon O'Kelly, physical therapist and president of IRG Physical and Hand Therapy. And our guest, Dr. Ruchi Sharma, internal medicine physician from Pacific Medical Centers.
Dr. Sharma, welcome. How you doing?
I'm fine, thank you.
Thanks for coming on. Listen, I don't think a lot of people really understand, when we talk about internal medicine and then more importantly, kind of your specialty is infectious diseases. Tell us about internal medicine, the training, and then tell us how you had an interest or got interested in infectious diseases.
So internal medicine residency is done after medical school. It's a 3-year residency program that we go through. Infectious disease is a subspecialty of internal medicine, which encompasses all general infectious diseases, be it viral, bacterial, fungal. Most commonly, people have come to associate infectious disease specialists with recent outbreaks in the community with tuberculosis, lately measles, Ebola virus, and HIV and hepatitis.
Yeah, and it seems like in today's world, we see some of these diseases that we thought were eradicated, and all of a sudden they're reoccurring, particularly in the United States here. And one of the things we want to talk about today is this measles outbreak, because when I was a kid, they gave us shots and measles. I remember kids in the neighborhood, and this is a little while ago, so I'm getting old, right? But I remember kids in the neighborhood had measles, but then it disappeared, and now all of a sudden there's this increased incidence and more in the media. Tell us about measles.
So measles is a highly contagious viral illness. It is caused by a virus. It circulates in the community, and it is true that it was eliminated from the United States in year 2000. Well, eliminated is not really synonymous to eradication, but we did really well with immunization programs that was rolled out after the live vaccine was available in 1963. So it's essentially an illness of kids under the age of 5, but it can infect adults who may not have received a vaccination or incomplete vaccination with one of the 2 vaccines. We have also seen travelers from various other countries come into the United States and bring viral illnesses to the community. And another factor that has resulted in outbreaks indigenous to the country is unvaccinated communities, similar to Ohio outbreak a few years ago, where unvaccinated individuals had about 300-odd cases in the community.
Okay, so, I kind of want to break this down because a lot of information. So to clarify, so I'm 52 years old, and in my day, they gave us a vaccination for the measles at school. So at 52, is my vaccination good enough to cover the spectrum? Am I protected, or do I need a booster?
So most adults who have received 2 vaccinations are considered immune. If there is any question about whether you received one of the 2 vaccines or if you were not adequately vaccinated in childhood, then you should consult with your doctor. But I would consider most individuals after the 1963 vaccine and who have received 2 doses should be immune.
Okay, so I think that if you're an adult and you're concerned, then you just need to talk to your family physician, and they'll trace those records back and look in your vaccination history.
Absolutely.
Okay, then we talk about non-vaccinated children in these communities that don't have any, what is you want to call it, antibodies to the measles?
Right. So if somebody gets measles as an illness, they are considered to have lifelong immunity. However, we have seen a decline in measles, and we do offer vaccine which is given to children between the ages of 12 to 18 months, followed by a booster at ages 4 to 6. This confers pretty good immunity. With the first vaccine, about 93% would be immunized, and then the booster vaccine attains about 97% immunity, which is fairly good. So these unimmunized kids, which may be for several reasons, if they were too young at the time when they had the outbreak, or if they are not vaccinated because of religious or philosophical beliefs, then those remain at risk, and surrounding kids who may be exposed to unvaccinated and ill kids.
Okay, so we've had some recent outbreaks in certain parts of the world and the country here in the United States, which, again, I find kind of odd because, again, I thought it was an eradicated disease, and here we're seeing it again. Are these kids that were not vaccinated mostly?
Yes, it has been reported that most of these outbreaks have occurred in unvaccinated individuals. Measles would not be called eradicated. Eliminated, certainly, but we have seen resurgence of measles cases in unvaccinated individuals who have either traveled from another country or in communities who may not have had higher vaccination rates for lack of health care or for religious or philosophical beliefs or for concerns regarding the MMR vaccine, which was at one point linked to autism.
Right, I've heard that. Here in the state of Washington, I'm sure we have a health system that keeps track of any kind of these infectious diseases that are on the rise or there's an outbreak. Are you involved in that reporting aspect?
Well, there is a list of infectious diseases that is reportable to Department of Health. This is followed all over the country, and all physicians, including infectious disease or internal medicine, family medicine, we are required to report anyone who may come positive for any of these communicable illnesses.
Okay, so we've talked about the rise of measles. But how do you know you have it? What are the signs and symptoms, and what are the concerns, and why is it so dangerous?
So measles usually starts off with runny nose, red watery eyes, coughing, sneezing, and then people will go on to develop a rash. The rash usually starts out on the forehead and then travels along the neck, the torso, the upper trunk, and then to the extremities. Usually these people will present with high fever as well. So basically it is a viral exanthem, or essentially a fever with rash, that may occur in children or adults who get infected with measles. It is highly contagious, so they will spread it to people who have not been vaccinated or who have not had adequate vaccination. And the concern is that measles is actually a fatal illness. There have been deaths that have been reported secondary to measles. You can also have severe complications like pneumonia, including lifelong brain damage, which is something called panencephalitis. It is something very rare that most clinicians would not have seen in their recent training, but this can even occur years out from your measles, even years out from your infection with measles.
Okay, so again, let's just kind of follow the bouncing ball of this disease. So the rash and the fever is not a real danger. You're talking about kind of a sequela. It's the pneumonia or the brain damage that can occur. Is that the body trying to fight the virus that kind of causes this cascade of other illnesses?
Well, yeah. Well, the rash and fever are dangerous as well, because certain children who are really young will get fevers as high as 105 or 106. This can precipitate seizures in children. But more than that, they can have ear infections, and then it is the late complications or severe complications that may compromise their respiratory status or their brain damage that can linger on, and which is why it is essential that we immunize our kids, and immunity in the community can be very helpful for one and all.
The spread of the disease in the incubation period, is this droplets by cough or sneeze, or is it contact, airborne? I mean, how is it spread, and what is the incubation period?
That's a very good question. So the incubation period is about 7 to 21 days, usually 4 days prior to the onset of the rash, and it will continue to be, and the person continues to be contagious 4 days after the onset of the rash. Like I said, it's highly contagious. So yes, coughing and sneezing and close contact is certainly a risk factor, but you really do not need person-to-person contact for transmission. And this has been well documented in patients who may have been exposed to a sick child in a physician's office, airplane co-passengers, recent Disneyland outbreak that has occurred in the community, and people who are traveling from abroad who may be unvaccinated may still not have the fever and rash on arrival, but they are contagious, and we have documented these cases in King County and SeaTac Airport.
Okay, and how close do you have to come in contact with someone who might be infected?
It has also been documented that you do not have to be in contact, but if you are within 2 hours of contact or being around in the surroundings where an infected individual was present, you can still get infected. And
so the virus that's out there infecting people, I mean, after 2 hours it dies. Is that kind of? I mean, so it's not contagious. I mean, 2 hours is an interesting time period.
Yes. So you do not need person-to-person contact, but anywhere where there might be droplets or they might be present on the surfaces, and if you do come in close contact, then yes, it will be transmitted to individuals who either do not have natural immunity or immunity from the vaccine.
Okay, as an infectious disease doctor, so your rule of thumb, in today's world, because, parents work, we have to take kids to daycare. If a child has a fever, runny nose, should he just stay home?
Definitely. If you have manifestations of an infectious illness, which can be fever, rash, conjunctivitis or pink eye, runny nose, coughing, these are all transmissible. They may be measles or they may be a manifestation of another illness like flu-like illness, which also occurs very commonly in the winter. These are easily transmitted to other people, healthy individuals, children, daycare centers, and hospitals, and even physician offices, waiting rooms. So I would strongly recommend that if your child is sick, you keep them home. This would also limit transmission to other children in the community. And same for your kid. If there is a sick kid who's coming to daycare, he's more likely to make your child sick. So if they stay home, then we contain these outbreaks in the community.
Wow. Okay, so you have a fascinating job. I can see, your passion. We have to have you come back because we have a lot of infectious diseases we can talk about. But if someone wanted to talk to you and get a hold of you and had some questions, how would they do that right now?
They can contact us at pacificmedicalcenters.org or call 425-412-7200.
Thank you.
If you would like more information on this topic, as well as how to contact Dr. Ruchi Sharma, go to pacificmedicalcenters.org or go to irgpt.com and click on the Health Experts tab.